Next, immunity. In terms of immunity, hepatitis B immunoglobulin offers immediate protection. Ano daw po ang ipino-provide ng ating Hepa B immunization? Immediate protection kapag immunoglobulin. Next, anong klaseng immunity naman ang kino-confer ng ating tetanus toxoid injection? Lifelong active artificial immunity. How about naman daw ang breastfeeding? Anong klaseng immunity naman daw ang binibigay ni breastfeeding? Natural passive immunity. Next, ano daw ang protein na involved sa immune system? Globulin. The protein involved in your immune system is the globulin. Okay? So yung bata, magkakaroon lamang yan ng immunity for just 1 year. Lahat na nakuha niyang natural passive immunity kay nanay, 1 year lamang po yung kanyang itatagal. Next, climate change. Gas, we have your gas which is produced via burning of fossil fuel. Ang pinaka-primary gas po natin dyan is your carbon dioxide. Always remember that carbon dioxide is your primary driver. Yan, the primary driver of your climate change. But not the most abundant. Ang most abundant greenhouse gas ay water vapor. But ang pinaka-driver ng climate change, driving force kung tawagin natin. The driving force of your climate change is the carbon dioxide. Not a greenhouse gas, oxygen. Not a greenhouse gas, oxygen. Okay, next. Greenhouse effect. Ano daw ang ibig sabihin ng greenhouse effect? Ability of the certain atmospheric gas to trap the heat and keep the planet relatively warm. Hanapin mo yung trap the heat. Greenhouse kasi yun. Trapping the heat, keeping the planet warm, greenhouse effect. As a nurse daw, how can you mitigate global warming? By planting trees and conserving energy. So what is the call for climate change action? SDG number 13. SDG number 13. Okay, SDG number 13. Next, rabies. Causative agent is causative agent of rabies, virus. Yan, virus. Next, best strategy to control incidence of rabies, responsible pet owner. Yan, responsible pet ownership. Best advice in case of dog bite. Wash thoroughly with running water, soap and running water. So ano daw ang gagawin ng may-ari kapag nakakagat yung aso niya? Feed well and observe the dog for 14 days. Feed dog and observe the dog. Important information about rabies. Rabies is preventable. Transmission of rabies by saliva. Again, transmission of rabies is by saliva. What is the vector of rabies? Dogs. Vector of rabies, dogs. Malnutrition. Undernutrition, common daw po ito sa 2 to 4 years old. Yan, maugong na balita. 2 to 4 years old, malnutrition. Pag undernourished ang bata, that is your low weight for age. Yan. Low weight for age, undernutrition yung ating bata. Old man's look, marasmus. May protein deficiency, anong ilalagay mo sa diet? Egg. Undernourished yung bata, weight for height. Then, micronutrient for physical and mental development of the child, iodine. Nakakatalino kasi yan. So, pag may kinalaman sa mental development, iodine po ang sagot natin dyan. Okay, next, research. Inductive reasoning in research, qualitative research. Inductive reasoning, qualitative. Deductive reasoning, quantitative. Yan, again. Inductive reasoning, qualitative. Deductive reasoning, quantitative. Accuracy of themes, use dependability. That is your credibility. Paki-correct po yan. Accuracy of themes, that is your credibility. Again, paki-correct yan, it is your credibility. Accuracy of themes is credibility. Okay? Wait lang, i-correct ko kasi baka mano na mga recordings. Again, so accuracy is credibility. Okay, asan na tayo? Wait lang. This one is credibility. Not reliability, it's your credibility. the credibility or the accuracy. Okay, next. Involves social processes, grounded theory. Social processes, grounded theory. Neutral observer ang researcher, quantitative research. So in quantitative research, neutral po yung ating observer. Next, in probability sampling, anong nire-reduce daw niya? Bias. So what is the best way when selecting samples to prevent bias, to reduce bias? It's your probability sampling method. Yan, probability sampling methods. Next, epidemiologist. Scientist of TB, Robert Cox. Gumawa ng anthrax vaccine, Louis Pasteur. Gumawa ng smallpox vaccine, Edward Jenner. Nag-aral ng outbreak ng cholera, John Snow. Ano yung mayroong outbreak sa Soho, London? Cholera. Ano daw yung pinag-aralan niya? Cholera. Sino yun? John Snow. Father of epidemiology, John Snow. Okay? Who is John Snow? The father of epidemiology. Yan. Again, anong pinag-aralan sa outbreak of Soho, London? Cholera. Okay, sino ang father of epidemiology? John Snow. Yan, John Snow. Okay, COPAR. Nurse in COPAR staff, expert. End goal of COPAR, self-reliance. Development of criteria for site selection, done in pre-entry phase. Done in pre-entry phase. Wait lang. Saan na yan? Okay, next. End goal, self-reliance. COPAR, active participation. Why? Passive to active community. Always remember. Yan yung gusto ni COPAR, may active participation. Next. Nephrotic syndrome. NP3 question. Tama, NP3. Number 1. Passage of protein in the urine is the result of what? Bakit daw may proteinuria ang nephrotic syndrome? Number 1 question niya po yan. Because of glomerular permeability. Because of your glomerular permeability. Outstanding manifestation of nephrotic syndrome, edema. Number 3. Physical appearance of the urine, frothy. Frothy. Next, nephrotic syndrome, ordered corticosteroid. May gamot daw siyang corticosteroid. Not allowed daw ang relatives with upper respiratory tract infection. Why? Naka-corticosteroid yung bata. Number 5. Common side effect ng corticosteroid, increase in body weight. NP3 question, abangan natin. Common side effect, increase in body hair. Increase in body hair. Integrated concept, NP1 to NP3. Number 1. What is PDCA? Plan, do, check, act. Mapping proposes process. Saan daw ginagawa sa ating PDCA yung mapping proposed process? That is during of your PDCA. Next, ano daw nag-cause ng ating nephrotic syndrome? Yun yung kanina. Increased glomerular permeability. Number 4. Abruptio placenta. Anong sign ng abruptio placenta? Concealed rigid abdomen. Number 5. Weight loss after pregnancy. 8 to 13 pounds. Number 6. Enema position, left side lying. Number 7. Enema before colonoscopy for gallbladder. Anong tawag mo daw doon? Cleansing. Ang tawag mo sa enema na ginagawa bago i-colonoscopy yung pasyente sa gallbladder or may sakit sa kanyang gallbladder. Cleansing enema. Next, number 8. There's in COVID facility priority, implement health protocol. Ang choices dyan, monitor vital sign, maintain sterile areas, yun yung mga choices. Ang sagot natin, implement health protocol. Number 9. Cause of children nephrosis, unknown. Pag tanong ka, what is the cause of children nephrosis? Unknown. Number 10. How many hours newborn temperature stabilizes? 4 hours. 4 hours. Cause of bleeding in abruptio placenta, maternal hypertension. Kaya po sila nagkakaroon ng bleeding in abruption placenta because of maternal hypertension. Number 12, priority of family planning, pills. Pills. Number 13, copper IUD, how many years? 10 years. 10 years. Number 14, how many eggs is fertile in entire woman's life? 400. Pag nabuntis ang isang babae nagkakaroon ng 400 to 500 fertile eggs in woman's life. Number 15, baby with physical defect, kanino mo i-report una? Physician. Temper tantrums, do nothing, ignore. Number 17, streptokinase, dissolve clots. Okay, to dissolve clot, give streptokinase or alteplase in MI. Next, toddler, attempt to get the doll but failed. Ano gagawin? Set limits. So give another child. Give another doll. Yan. Give another doll. Choices. Number 19. Universal standard. Universal standard to determine patient with allergy. Red wristband. Red wristband. Next, number 20. Never event. Never event. Example daw ng never event. Surgical sponge left in patient incision. Pag may natirang surgical sponge, that is the example of never event. Okay, never event. Number 21. Patient fell on bed. Notify the healthcare provider or physician first. Yan. Next, number 22. Standardized wristband color. Red for allergies, yellow for your fall risk, purple for your DNR, and yan. Who will change your patient wristband? Physician. Yan, physician. Number 26. Pulse check site in CPR near the patient ear. Ano daw yung pulse na yon? Near the patient ear. Carotid. Carotid po ang tawag natin to. Dito. Compression depth in CPR, 1.5 to 2. When to stop CPR? Except patient vomits the water intake. Ang choices po niyan is no respiration, no pulse. Yan. No respiration. Hindi pala. May respiration na siya, may pulse na siya, at saka nag-groan na siya or conscious na siya. So sagot dyan, except patient vomits the water intake. So still, i-continue mong CPR kahit lumalabas yung tubig sa bibig niya. Okay? Next, number 29. Patient receiving diuretics, except loss of protein. Yan, loss of protein. Choices, hypokalemia, hyperkalemia, hypercalcemia. Number 30. Patient with allergy. What tag in chart? Anong tag in chart? With red ink. Red ink ang gagamitin natin. Next, number 31. Bulimic patient. May bulimia siya. Nag-induce ng vomiting. Ano mangyayari sa kanya? Metabolic alkalosis. Metabolic alkalosis. Number 32. Drug of choice for schizophrenia. Haloperidol. Haloperidol. Number 33. Pre-measured insulin. Anong gagamitin natin? Insulin pen. Pre-measured insulin, use insulin pen. Number 34, insulin injection, except rub or massage for 5 seconds immediately after injection. Yan yung except. Parang nasa intraboard din yan or macboard. Parang na-encounter na natin yung tanong yan. Number 35, Apidra, rapid acting. Humalog, rapid or fast acting din. Rapid acting is also known as the fast-acting insulins. Number 36. When to give Apidra? 10 to 15 minutes before meals. Kapag regular insulin naman, 20 to 30 minutes before meals. Next, number 37. Treatment of your hyperkalemia, kayeksalate. Again, treatment of your hyperkalemia, kayeksalate. Wait lang, excuse lang po. Okay. So we have your treatment of kayeksalate. We have your hyperkalemia. Number 38. Patient having seizure, monitor first. Maintain your airway. Airway pang priority natin dito. Wala po dito yung safety ngayon. Wala po siyang safety ngayon. Ang nandoon is maintain patency of airway, time the duration of the seizure. Pinaka-priority natin dyan is airway pa rin. Okay, airway pa rin. The next we have Oscar number 39. 1984 Knowles. Ano daw po yung 1984 Knowles? Ano sinuggest po niya? The 4 principles of adult learning of environment. Next, list or not included with the use of spirometry. Use your nose daw. Wrongness. Use your nose? No. So, ano ginagamit natin kapag naka-spirometer tayo? Mouth. Yan, mouth. Yan. Next, para lumabas yan sa ating intraboard din yung isang item niya, yung ilabas mo yung hangin sa ilong, inhale mo sa bibig. Yun yung tanong din dyan na isa. Number 41. Upper endoscopy, ano daw po yun? For PUD. For PUD, ano daw po yung ating gagawin? Upper endoscopy. Next, burnout therapy. Anong gagamitin natin for burnout therapy? We have your listening to music. Listening to music. Yan. 43, progressive muscle relaxation, release muscle tension. Release muscle tension. And number 44, burnout. For burnout naman, exhaustion. Physical exhaustion and emotional exhaustion. 45, levothyroxine, morning before breakfast. It should be empty stomach, before meals, or before breakfast, early in the morning. Yes po, listening to music ang answer. Yun yung pinaka-the best na choices doon. Listening to music. Pero pag ang labas sila is progressive muscle relaxation, release your muscle tension. That is the purpose. Next, may problem sa parotid gland. Ano daw dapat laging ginagawa? Mouthwash. Parotid gland. Next, caution us. Para saan daw ito? Warning symptoms of cancer. Angina pectoris, drug of choice, nitroglycerin. Next, MI. Ano daw makikita mo sa MI? ST wave changes. ST wave changes. Number 50. Teenage pregnancy. Kailan daw i-repeat yung test? After 1 week. After 1 week. Number 51. Pregnant. Takot siyang magpa-check up kasi may COVID. Anong advice mo daw as a nurse? Still yes, she can go for check up. Yes, she can still go for check up. Okay, dapat encourage mo siya na dapat magpa-check up pa rin siya kasi buntis siya. Next, number 52, pregnant. About COVID vaccine, ano daw sasabihin mo? COVID vaccine is safe to receive anytime during your pregnancy period. Anytime. Regardless of the trimester, regardless of the AOG, anytime of your pregnancy, pwedeng ibigay yung COVID vaccine. Okay, COVID vaccine. Next, COVID pregnant. Okay, COVID vaccine. Okay, sorry. COVID pregnant increases the risk of preterm delivery. So marami po dito ang premature babies kapag may COVID yung nanay. Next, what is S in S-bar situation? Di ba nasanay ko sa F-dar? S in S-bar situation. A in F-dar, action. Okay, huwag niyo kakalimutan yun nasa ating intraboard. Next, number 56. Anesthesia for cardiac surgery, general. Anesthesia for abdominal surgery, general pa rin. Okay, next. Pulse oximeter, normal, 95 to 100. 95 to 100. Next, acute kidney disease, hypoperfusion, pre-renal cause. Pre-renal cause. FDAR, Focus Data Action Response. Dapat alam mo yan. Next, number 60. Ano daw yung except in charting? Except the use of jargon phrases. Use jargon phrases daw. Except. Use jargon phrases. So, do not use jargon phrase kapag magcha-charting ka. Number 61. Nurse sticks on her duty. Okay. Wrongness. That is your non-maleficence dapat. Nurse sticks on her duty. Non-maleficence. Paki-correct yan. Non-maleficence na number 61. Number 62. Informed consent. Walang autonomy doon. Ano pwedeng isagot? Beneficence. Again, pag informed consent at wala si autonomy, beneficence ang sagot. Okay, palitan ko daw. Wait lang. Again, pag wala pong autonomy sa informed consent, that is your what? That is your beneficence. Yun yung kasi yung ating principle na meron sa informed consent. Okay, ulitin ko, we have your beneficence dapat. Yan, pag walang autonomy. Ito naman, that is your non-maleficence. Okay, sige, screenshot nyo na yan. Na-correct ko na. So again, so we have your stick nurse on her duty, non-maleficence, informed consent, walang autonomy, beneficence. Use of placebo transgress veracity. Pag nawala si veracity, answer nyo naman autonomy. Okay, pag wala si veracity, answer autonomy. Next, after cardiac catheterization, ano daw mararamdaman ni patient? Choices, dizziness, nausea, palpitation, feeling of warm. Kasagot, feeling of warm. Next, hypothyroid. Tapos nagkaroon daw po ng stunted growth yung bata. Anong sakit yun? Cretinism. Not bata, patient pala, sorry. Hypothyroid at stunted yung growth niya. Anong klase po yun ng hypothyroidism? Cretinism. Okay, ulitin ko. Hypothyroidism, nag-stunted yung growth niya. Anong klase po yun? Cretinism. Stunted growth ang ating keyword. Bansot. Cretinism. Next, Billroth 1, complication, dumping syndrome. Non-invasive procedure is sputum exam. Sputum exam. Number 68. Pag walang 8 months, 9 months. Okay, next 15 months, walks alone. 12 months, walks alone na rin. Next 9 months, peek-a-boo. Peek-a-boo kapag 9 months. Next number 71, Parkinson's patient. Anong kaya po, anong meron kay Parkinson's patient? Shuffling gait and tremors. Shuffling gait and tremors. Next, Parkinson's pa rin. Ano po ang ating priority nursing diagnosis? Risk for aspiration. Risk for aspiration. Next, number 73. May increased ICP ang pasyente. What is the position? High Fowler's. High Fowler's. Number 74. Prozac. Antidepressant Prozac. Adverse effect. Decreased libido. Decreased libido ang sagot natin. Number 75. Alcohol withdrawal. Nawala si lorazepam, diazepam. Pag nawala si lorazepam, diazepam. Pag naglaban sila ni lorazepam, lorazepam. Okay, anong mas first choice natin? Lorazepam. Lorazepam Ativan. Lorazepam Ativan. Yan, Ativan. Seizure. Paano mo ito malalaman na may seizure ang pasyente? Stiff and spasm. Yan, stiffness of the body and muscle spasm. Next, the arms extended at the sides, decerebrate. Arm extended at the sides, decerebrate. Arms to midline of the chest, adduction. Adduction. Next, to test corneal reflex, cotton wisp. Cotton wisp. Corneal, cotton wisp. Cause and effect, studying the cause and effect relationship, fishbone diagram. Fishbone diagram. Number 89. Highest level of measurement, ratio. Data can be ranking in ordinal. Yan again. Highest level of measurement ratio, data can be ranked in ordinal measurement. Number 91. The patient resisted IV to be inserted. Going against the will of your patient violates what? Autonomy. Autonomy. Next, after Billroth 1, ano daw po yung, hindi Billroth 1 nakalagay doon sa ating ano. Ay tama, Billroth 1. After your Billroth 1, ano daw yung mga magiging sintomas na titingnan mo? Assess symptoms like sweating, dizziness, palpitation. Sign of dumping syndrome yan. So ano daw yung i-assess mong symptoms after Billroth 1 and P3 question? Pati itong number 91 and P3 po yan. Pati itong number 93 and P3 po yan. Number 94 and P3 din yan. Okay, again. Autonomy kapag against the will. After procedure of Billroth 1, ano daw yung i-assess mong symptoms? Sweating, dizziness, palpitation. Why? Those are signs of dumping syndrome. Next, number 93. Nagkaroon ng allergic reaction yung patient mo under blood transfusion. What is your first action? Stop. Stop the blood infusion. Next, number 94. What is the confirmatory of prostate cancer? Do not answer DRE, okay? Not DRE ang sagot. Answer is biopsy. Confirmatory of prostate cancer biopsy. Number 95. The nurse commits medication error. Wrong antibiotic given. When will you document? Where will you document? Progress notes, nursing care, discharge notes, nursing care. Nursing care. I-document mo siya sa nursing care or nurses notes kumbaga. Next, number 96. What is A in the FDAR? Action. What is R in the SBAR? Recommendation. Okay, next, number 98. Participant and the experimental researcher do not know. Ano yun? Double-blinded. Yun yung lumabas. Yan yung lumabas sa ating, blinding. Double-blinded. Saan ginagawa yung blinding? Experimental research. Yes or no? Experimental research. Doon ginagawa yung double-blind, yung ating blinding. Next, live experiences of Igorot and Mangyan. Phenomenology. Ano daw klaseng research yun? If you are studying the live experiences of Igorot and Mangyan, phenomenology. Next, data repetition. Ang tawag doon, saturation. Nagkaroon na ng data repetition, ang tawag doon, data saturation. Next, bago mo daw ibigay or i-receive yung baby sa NICU, ano daw ang unang gagawin? Identify the name of the baby. Identify the name of the baby. Again, 1 year old and 15 months, the child can walk alone. The child can walk alone. 103. Hypothyroidism, except or not. May bradycardia naman dyan, may weight gain dyan, may constipation dyan, pero walang excessive fatigue. Walang excessive fatigue, except excessive fatigue. Documentation except question. Use any abbreviation daw, except use any abbreviation, except use any abbreviation. So kasi kailangan ay gumamit ka lamang ng approved abbreviations. BTL prevents the course of fertilization. Ano daw ang course na prevent ng BTL? It prevents your fertilization. Yan. It prevents your fertilization. Okay, next. What is binge eating? Letter A ang sagot. Binge eating, letter A ang sagot. Eating more in less amount of time. Letter B is taking laxative, enema diuretics, that is your anorexia nervosa. Letter A is eating more in less amount of time. Next, number 107. Assessment for bulimia except protein loss. Ayan, protein loss. Ito pala yun, protein loss. Ito pa yun. Sa bulimia pala yun, hindi sa diuretic. Okay, ulitin ko. Assessment for bulimia, not in diuretic yung kanina. Except protein loss. Okay, hypercalcemia, pwede mangyari kay bulimia. Hypokalemia, pwede mangyari kay bulimia. Hyponatremia, pwede mangyari kay bulimia. Protein loss ang sagot natin. Next, ABG, what will regulate our blood pH? Carbon dioxide. ABG, 2 buffer organs, lungs and kidneys. Lungs and kidneys. 2 buffer organs, lungs and kidneys. Ano daw nagre-regulate ng blood pH? Carbon dioxide. Carbon dioxide. Next, position of patient after laminectomy. Place pillow between the patient legs and turn the entire body as a unit. NP3 question, lalabas sa board exam. Position after laminectomy. Place pillow between the patient. I think na-post ko na po ito. So next, signs of tonic-clonic seizure, we have your most common form of seizure. Myelogram is to diagnose herniated disc. Next, malapit na po tayong matapos. Priority in your seizure, airway. Airway. So always assess the client's breathing pattern. Yes po, Boyd cram sheet NP5. Nandyan yung mga kailangan nyo sa NP5. Ischemic stroke. Yan. Receives recombinant tissue plasminogen, TPA. So, kailan mo daw ibibigay yan? Which is the priority nursing assessment? Why is he given this drug? TPA is given para ma-dissolve ang clot. Ma-dissolve ang clot. So pinaka-importante po na kailangan natin alamin dyan is the time of onset of current stroke.
Astig
Blood at regular
nurse,
Astig nurse blood. So cotton tip applicator pa rin. Cotton nurse pa rin. Yung cotton
Astig nurse vlogs, di ka manood na makinig at tuturuan kita paano magkamot. Pero bago ang lahat, tutunan magbanat na pangalan ng mga sa pangarap isagat. Kay Jonas, Marvin, Anike mo, makita ko ang paano iangat ang sarili. Nindigan sa Diyos sa kasing mga mahal, walang imposible. Alam ko na kaya mo maniwala sa sarili. Ako di lang kahit gano'ng katagal at sipagan mo lamang dahan-dahan. Dahil kasama mo ang punong may kapal.
Determinadong pumasasabot sa declaring business name, papasapahan sa magtiwala. Okay? So galingan na sa board exam ninyo. I believe sa
Astig nurse vlog, dami mapagsubok, di wala lang sa sarili ang laging katapat. Astig nurse vlogs, dito ay tapat at mabuting puso dahil lamang yun kay God. Astig nurse vlog, dami mapagsubok, di wala lang sa sarili ang laging katapat. Astig nurse vlogs, dito ay tapat at mabuting puso dahil lamang yun kay God. Pawis luho oras ang aming binubuhos, bago makamit dami rin ang pinagdaanan, pero kailanman hindi na pinanghinaan. Salamat sa suporta at sa mga naniwala, maipamahagi ang aking mga nalalaman. Handa na tumulong sa mga nangangailangan, buting kalagayan ang aming iniingatan. Di ako sikat kaya hindi malalaos, ang boses nilaan kaya hindi mapapaos. Kaya ngayon tingnan nyo kung saan na to nakarating. Pangarap ko dati ngayon ay hawak ko na din. Astig nurse vlogs, Astig nurse vlogs, Astig nurse vlogs, Astig nurse vlog, dami mapagsubok, di wala lang sa sarili ang laging